Do you ever feel like one hip is higher than the other, or your pelvis just feels off? You may be struggling with hip pain or sciatica or even pelvic floor dysfunction, and you're just trying to figure out what can you do to get yourself back in alignment? Today, I'm going to show you the #1 hack that physical therapists recommend to help improve your alignment and decrease your pain. This video is for you if you've ever been told that you have one leg shorter than the other, but not known what to do about it. Or if you suffer with low back pain and you feel like when you're walking in a cattywampus way. By the way, that's an official term, cattywampus. If you have SI joint pain, which is pain that's in your low back, and even if you have pelvic floor dysfunction. Having your pelvis or your SI joint be in alignment is important because of its connection to posture, to getting proper muscle activation, and to making sure that you can breathe correctly even. If you're not in the correct position, it puts increased stress on different tissues, which could be a part of what's causing your pain. I'm Dr. Amy, and we are empowering women with changing bodies to move pain-free. I have a PhD in orthopedic manual physical therapy, which means I spent 6 years after PT school learning how the body moves, and today I'm here to teach you. Now, a lot of people are wondering, how did this even happen in the first place? Because of course you want to avoid having it happen again. The causes can be different for different people. Often I see a lot of people in the clinic who sit for prolonged periods of time, and over time they get lazy with their posture and they scoot over to one side or scoot over to the other side. Ladies, it could be being caused by crossing one knee over the other, which we all do that all the time, most of us. So keeping both feet flat on the floor when you're sitting is critically important to eliminating this issue. You may also be involved in a one-sided sport where you're pushing off consistently with one foot and not with the other, and that can cause your pelvis to get out of alignment. You may be someone who stands with your weight on one foot or another. Think about moms as they're holding their babies. If you constantly hold your baby on one side, that puts increased force through that hip as opposed to the other hip. Or you could be like me. My SI joint went out of alignment because I was driving a stick shift car while I was pregnant as well as after pregnancy, and having that abnormal force from one foot to the other is what I think threw my SI joint out of alignment. Unfortunately, I didn't realize it at the time, so now I have to do exercises like this to help put it back in alignment. So I'm going to demonstrate the technique, and then afterwards we'll talk about how often and when you should do it. So a couple of things that you're going to need before you get started. So I use this handy dandy branded TheraBand, but you don't need anything like this. Any TheraBand will work for this. You can also use a belt. A belt actually works ideally for this because it has a little bit less stretch than the TheraBand. This one happens to be a pretty tight one. So if you are using a TheraBand, you want something that is going to be pretty tight, or just go ahead and grab a belt and you can use that. The other thing that you're going to want to have on hand is something to put in between your knees. So we use this towel and we just roll it up like this. You could also use a small ball, anything that is going to keep your knees from pressing against each other and causing any pain. Okay, so to get set up for this exercise, we're going to take the TheraBand and we're going to put it around our knees. Since I have 2 loops, I'm going to put one foot in each one. But again, a regular TheraBand would work. If you're using a belt, you're just going to tie it around both knees. And if you're using a belt, make sure that you notch it so it's actually going to be tight. Okay, so that's around both knees. And then I'm going to put my towel, pillow, ball, whatever you're using, in between the knees. All right, so you're going to lay down, and you're going to put your feet are flat while you're doing this. All right. Now, you're not going to be able to see a lot of motion when I'm doing this, so just understand this video is more about listening to what's happening than actually being able to see it. So the first thing I'm going to do is I'm going to squeeze my knees together as hard as I can, and I'm going to hold it for 10 seconds. 9, 8, 7, 6, 5, 4, 3, 2, 1. Then I'm going to relax. Now, when I'm relaxing, notice that I'm keeping the towel there just for ease, really, but I'm relaxing the muscles that are on my inner thighs. So we're going to do that for 10 seconds. Then we're going to squeeze again for 10 seconds. And hold. 2, 3, 4, 5, 6, 7, 8, 9, 10. Again, I'm relaxing those muscles on the inner thigh for 10 seconds, giving them a chance to recover. We're going to do one final squeeze in for 10 seconds. And then as soon as we finish that, we're going to squeeze out for 10 seconds. That one, you'll be able to see a little bit of motion. At that point, the towel is probably going to fall down. That's fine. I'm not concerned about it because that's going to be the end of the exercise. So we're going to squeeze one more time in for 10 seconds and hold. 2, 3, 4, 5, 6, 7, 8, 9, 10, and then we're going to go out. Hold. 2, 3, 4, 5, 6, 7, 8, 9, 10. And you're done. So when you're doing this technique, you're going to squeeze in, squeezing your knees together, holding for 10 seconds, then relaxing for 10 seconds. You're going to do that 3 times, and then you're going to immediately squeeze out, and you're going to hold that for 10 seconds. Now, what are you going to feel while you're doing this? You should feel the muscles of the inner thigh, so the ones in between your knees are going to be squeezing them together. You should feel those muscles activating, as well as when you push out, you should feel the muscles on the outside activating. What this is doing is getting those muscles to contract, hold, and relax, which will help to decrease the muscle tone and also help to relieve the stress that's on the joint, because those muscles impact that SI joint and will help to improve your alignment. Now, this exercise should not be painful while you're doing it. In fact, you may feel like I can feel my muscles contracting, but I don't feel like it's actually doing anything. And that's fine. As long as your muscles are contracting, you're having an impact on that joint. However, if you have any pain while you do this exercise, please do not do it, because this exercise, like all the ones we recommend on this channel, should be pain-free. Now, how often should you do this? Anytime that you're feeling off, and especially if you have any pain, it's safe to do this exercise. I do also have some people who have a history of their legs being off who like to do this exercise right before they're doing any kind of activity that may aggravate or exacerbate their symptoms. It's more just like they want to check and make sure they're in alignment before they do anything else. So the frequency is variable based on your sensation and what you're feeling. This is not an exercise that you have to do every day in order to maintain your results. It's really one that you should do when you're feeling off, when you're feeling pain, or before you do an activity. If you do any exercises specifically for your low back or your pelvic floor, I would recommend doing this technique first to make sure that everything is in alignment and you get the maximum benefit out of the exercises you're doing. This really helps with your whole body balance. When your pelvis is in alignment, your spine can stack up accordingly. When your pelvis is in alignment, you can walk with a normal gait pattern. And when your pelvis is in alignment, all of the muscles are able to activate correctly. So it helps to support your long-term health as well as any injury recovery that you may be going through. You don't have to live with a chronic misalignment issue. Use this technique to put yourself back in alignment and realize that if you're retraining your body because you've been out of alignment for a long time, you may need to do this exercise more frequently. Just remember, it should always be pain-free. Make sure you do this exercise every time you feel off or you have any of your pain or symptoms. Also, if you're doing any low back or pelvic floor rehab or exercises, make sure that you're doing this exercise first to put yourself in alignment. If this video has been helpful, please give it a thumbs up. Don't forget to click subscribe. And if you are suffering with pelvic floor dysfunction and you're wondering what exercise you should be doing instead of Kegels, I'm going to have you check out this video over here.